Greetings, I'm Kevin Sowers, President of Johns Hopkins Health System and Executive Vice President of Johns Hopkins Medicine. Over the last year, I've shared a series of conversations with senior leaders who have recently been appointed to their roles. Today, I'm continuing this series of dialogues by introducing you to Annemarie Martin-Boyan, Esquire. She's the Senior Vice President and General Counsel for the Johns Hopkins Health System and the Johns Hopkins Hospital. Annemarie started in this role at the end of February and comes to us from Penn State Health, where she also served as General Counsel. Annemarie, thank you for joining me here today.
I'm delighted to be here.
Well, we're glad you're here. So, one of the things that stood out during your interview process was just your extensive experience in the legal field. And, you've got experience of working in children's hospitals, also the experience of working in complex academic medical centers. Can you talk about your educational experience and kind of your career path that got you here?
Sure. I spent 23 years working in academic medical centers in the Eastern Seaboard. And before that, I spent 7 years as a medical malpractice and products liability lawyer. That was my segue into the in-house world because I came in managing litigation, but quickly found that in an academic medical center, there is just a breadth of opportunity to learn all sorts of complicated, interesting, exciting legal matters. So as soon as I stepped into my first role in-house, I did the work related to the malpractice litigation, but immediately got involved in institutional review boards and medical staff matters and bylaws revisions and regulatory work. And so it's just a fascinating, exciting new world for me. And it's continued to be fascinating and exciting for 23 years. And so I went from one academic medical center in Philadelphia to the Children's Hospital of Philadelphia, and then to Rutgers University in a leadership role, and then finally to Penn State Health before here. And at each of those places, I think the most exciting and rewarding part of being a legal advisor was the chance to work with people who are mission-driven, who were excited about not just the really important clinical work that they were doing, but also in developing the talent that was going to take care of us as we got older, the next generation of medical leaders and medical providers. But then also to sit on an IRB for 11 years and learn about what's to come for medicine 20 years from now as we invested in the research mission. All of those things, I think, for me, were the most rewarding parts of being a lawyer in this particular type of setting. And it's just been wonderful from that first time in-house until now, 23 years later. And I'm thrilled to bring all of that experience here to this place, which is so special.
Well, clearly, as we looked at your resume and went through the interview process, you literally have experience in all the elements that we need in a general counsel for a complex organization like this. One of the things that was interesting is on your resume is that you actually love teaching.
I do.
And one of the things that came out was you have won multiple teaching awards through the years. Can you tell us about that part of your career?
Sure. When I was deciding whether I wanted to go get a PhD after my undergraduate career, as my undergraduate career was coming to an end, or whether I wanted to go to law school, I finally decided on law school because it allowed me the opportunity to do both. I could be a professor because a law degree is a terminal degree, and I could also practice law. And one part of practicing law as a litigator is to teach your case and the facts of your case to the jury. So I think that it was a complementary combination of the things that I thought would be interesting to me as a career when I was embarking on my post-undergraduate education. And so in the early 2000s, I was approached to develop coursework for Drexel University's medical school because they were taking an innovative approach to education back then, and they were doing an online master's level courses in their medical school. And so that was just the first step, and then I also did about 5 years or so of work at Seton Hall Law School teaching research compliance, healthcare compliance, and the law of patient care. And so I think that was just a really fun way to supplement the work that I was doing in-house and the advising work with educating the next group of leaders that were going to come up through our ranks.
Well, that's great. That sounds like it was fun. Listen, your role requires not only providing us legal advice, but it also requires you to manage your own complex organization of a lot of legal advisors that we have within our organization. Talk to us a little bit about your leadership philosophy.
I would say that I've had the pleasure to work with really fabulous leaders over the years of my career in-house. And I've been able to observe the qualities that I think are the most effective in leaders. And then as a staff member working my way through the ranks, also got to appreciate what are the things that I would look for in a leader. And I tried to emulate the combination of all of those things in my leadership style. So I would say that first and foremost, collaboration in-house, where you have complex matrixed environment, where you've got multiple parties that have interest in the work that we're doing, is really important. And I think transparency is really important for the people who you're leading, because they need to know where they're standing and what's expected of them, and when they're succeeding and when they're not. So I think that's another important quality. And then I think what we learned during the pandemic was flexibility and adaptability and compassion are all really important qualities of a leader. So those are all the things that, as I am embarking on my role here, I'm trying to model with the people that I'm working with and demonstrate in my day-to-day interactions. And so I think that the first step when I came here was to try to understand who were the folks who were on this large, almost 100-person team under my purview. And the way that I did that was I opened up an opportunity for every single one of them to spend a half an hour with me describing what they do and what they feel about their role, what their growth potential and desires were. And also what was the nature of the legal work that we were doing that they were supporting, so I could learn about the issues that are most prevalent and important here.
I think what some people may not appreciate is the complexity of you oversee all of the hospitals, you oversee all of the joint ventures that we have together. Mm-hmm. So there's a lot of corporate entities that fall into your scope of responsibility. So Annemarie, there's another interesting question I have for you, and you've been here about 4 months. Mm-hmm. So first of all, what drew you to Johns Hopkins Medicine?
So when I saw this job description and I thought about the span of my career leading up to this moment, it almost felt like the stars were aligning and directing me here, because what you seem to be looking for in the way that was articulated and what I had been developing through the course of my long career just seemed to be perfectly aligned. So I thought to myself, I have to try, because this place is so special. And I was just drawn to the idea as an outsider, seeing Hopkins and seeing, particularly during the pandemic, by way of example, how the world looked to Hopkins to be a source of truth and information, as a source of medical innovation and a source of clinical innovation during a time when there was so much uncertainty. First and foremost, I think because I was applying during the midst of the pandemic, that came to my mind as, well, of course one would want to work at this incredible place. And the fact that I felt that my experience would be something where I could be immediately helpful and effective here just drew me to this particular role at this time in my career.
So tell me what you've learned most about this place in the first 4 months.
So I will say, you mentioned about the fact that this place has so many corporate entities. I don't think I appreciated quite how complex it was before I walked in the door. But I think the thing that I thought coming in the door was immediately validated in every one of these conversations that I had. And that is that one of the foundational principles here of the culture is collaboration. And the people here not only want to collaborate, they are passionate about it, and they love this place. And so I think coming in as a new leader, witnessing that firsthand in the interactions that I've had with some of our clinical directors and some of our administrative executives and my team also, has just been very reassuring that my initial impressions as an outsider were validated as I walked in the door.
That's great to hear, because I would agree with you.
Yeah.
It's a wonderful place for collaboration. So when you went home and told your family, we're going to Johns Hopkins Medicine, what was their response?
Well, they were surprised. I think that was step one. But again, they know what I do, and they know the market in which I'm working, and they also know full well how wonderful Hopkins is, because my brother-in-law has spent his entire career here as a clinician and a faculty member. So I think they were just thrilled for me. And I have an incredibly supportive network around me with my two kids and my husband, Mike, who's just always been there, supporting. So they were thrilled and excited, and we're huge sports fans. So it's exciting to come to a new city and try new stadiums and figure out new sports teams to love. And we love to go out to eat, and we love to cook. So all of those things, I think, Baltimore offers a wealth of, and so we're thrilled to be exploring a new city together, and they were thrilled.
Well, that's great. So listen, tell us a little bit about your family. Tell us about your husband and your two kids.
So my husband, Mike, is, like I said, just incredibly supportive of me and always has been. But he is retiring this Friday from a 27-year career as a teacher. So not only are we going through a transition in terms of moving to a new place, but he's going through a very exciting transition from teaching to retiree, whatever that's going to
And
be
what
for him.
grade did he teach?
He taught high school English, so there will be no ending of sentences and prepositions in our family. And our two kids, who are just incredible young adults and so much fun for us to be around, are both in college, one at Rutgers, our daughter Michaela is at Rutgers, and Cole is at Penn State. And so they're spreading their wings and doing their thing. And finally, with the pandemic easing somewhat, at least for now, they've gotten to experience college a little bit as they had expected it to be. And so that's been fun. And so we, like I said, we like to cook together and spend time together. And our family motto is, so long as we're all together, all is well. And so we like to spend time in the summers at Ocean City, New Jersey, and that's where our happy place is together.
That's great. So, when you think about your first 4 months, I know you have been meeting with lots and lots and lots of people across the organization. What do you think your first year will be like here?
Well, I think the most important thing initially is to get a solid foundation in who we are, and then what the legal department does to support who we are. And that's the part that's where I am right now. And I think that, as I said, I started with my group and then have expanded out to our leadership group and are meeting with folks to understand how the legal department interacts with them currently and where their needs might be. And when I say legal department, I mean legal, risk, compliance, audit, organizational equity, the entirety of the scope of the group that works with me. And then I think the next phase for me in terms of meeting key people is to spend some time with leaders at the university. As you know, every single day our offices are interacting with the University Office of General Counsel and our colleagues there. So making sure that all the lines of communication are appropriately open with them. And then I think the next step for me will be external stakeholders, peers in other organizations locally that interact with Johns Hopkins, as well as local political leaders. So I'm excited about getting to know a new city, and part of that is also getting to know the folks that are in the same business or affect our business, so that I can be an effective leader for the legal department here. And then I think the other thing I want to do is make sure that the legal department is accountable just the same way that every other operational unit of Johns Hopkins is, and that is, how do we measure success as a legal department? And so setting up those systems and processes that will allow us to be to demonstrate the value added for our group to Johns Hopkins.
Annemarie, thank you for joining me here today, and especially thank you for joining the Johns Hopkins Medicine family.
Thanks, Kevin. I'm so happy to be here.
I want to also thank you all for joining me here today, and I hope you help me in welcoming Annemarie to Johns Hopkins Medicine. Thank you.